can you deal with back pain at home before you see a professional or get a second opinion? So you've suddenly started to develop back pain, you're at home or you're working from home now. The first things you should consider doing is obviously book in to see a professional, find out the exact cause of your back pain and find out what you need to be doing specifically for you. But the second thing is avoid the bed rest, avoid spending too much time in one position. So you feel like you need to sit down all day because when you're up it's painful, but actually what you'll find is as you get up out of the bed or a seated position, you probably feel a lot of pain and stiffness. So my advice is move more throughout the day, gently, and plenty of variety of movement, so increase the frequency and variety of the movement. But don't spend too much time sat down or lying down. Obviously I know you have to sleep, but once you're up, move regularly throughout the day. So I'm not saying don't sit down, don't lie down. Of course, you've got to do that, but break it up throughout the day. Do it regularly. So if you're really suffering back pain, you might find you can only sit for 15 minutes. That's fine. Get up, move around, sit again. But I would recommend more movement. The old saying of bed rest and rest, that's gone out the window now. You need to be moving gently, keeping your joints all supple, keeping the flexibility in the muscles. But yeah, definitely keep moving. Obviously, I'm not saying go out for a run or go to the gym. If you're in that much pain, obviously you can avoid these, but you can go for gentle walks. You can potter around the house. You can possibly go swimming. But I would definitely go see a professional if you're thinking of doing anything more than that. But yeah, keep moving. But also, don't go out for extended walks. Don't go and stand for long periods of time. Don't go out shopping for hours on hours because this is going to aggravate your back pain. So you need to be breaking up the amount of time you're on your feet by sitting down, lying down and so forth. Personally, I would recommend avoiding the sofa or the couch, soft furnishings, because you're going to sink into a poor posture, you're going to overload the tissues in your lower back and the joints, and they're not going to like it very much. I'd also avoid sitting on the floor as much as possible. The best thing you can do is sitting on an armchair, which you've got a little bit of support, upright back. It's going to put yourself in a better posture, and you've got that support to get out of the chair as well. So that's my recommendation. So if you are going to sit in something that's going to provide you with support rather than slumping or lying down on the sofa. Third thing is your sleeping posture. So obviously you're going to spend a lot of time in one position. So when you wake up, you're going to be stiff. You're going to feel a little bit of discomfort. Don't sleep in the front, this is going to aggravate your back. Don't sleep in a recovery position where you're rotating through the lower back. Sleep on your side with both legs on top of each other. Place a pillow between your knees. It'll be a bit more comfortable and it'll keep your pelvis in a nice neutral position. Or you can sleep on your back, but place some pillows underneath your knees so you're flattening out your back. You're not going to go into that arch position, which is going to again aggravate your lower back. So there's definitely a couple of things I'd recommend if you're suffering with back pain at home. If you're working from home and you're suffering with lower back pain, again, you need to address your workstation, where you're working from, how you're working. So I've presented this and talked about this in another video, so go watch that. That's another thing to address there as well. And if you do need to take painkillers, then obviously read the labels and do so. I shouldn't have really said that, but can you cut that out? Or are you? Yeah, cool. So there's just a couple of things. If you're suffering with back pain at home, one, move more, better variety, but gently. So keep a little bit active, But even if you're active, you need to break that up with some time of rest, but no extended, for example, bed rest. Assess the way you're sleeping, and obviously alter the posture to take as much pressure off your lower back as possible. And the third thing is address your workstation at home, which I've discussed in another video. And the last thing, definitely go and see your trained professional. It could be a chiropractor, osteopath, physio. Definitely go and have an assessment, figure out exactly the cause of your problem and what you can do to prevent it coming back in the future and address it at this moment.